It's interesting. When I played hockey, we had this saying in the dressing room with a lot of the guys, you suffer in silence. Like, don't talk about your injuries, just play.
Feelings and emotions, it's difficult for a lot of people to talk about their mental health, but retired NHLer Trevor Linden is hoping to change that narrative. He's teamed up with the Canadian Men's Health Foundation, hoping to change the stigma surrounding mental health and to start a conversation.
Unfortunately, I think that's kind of men in general. Suffer in silence. Don't talk about it. Don't talk about how you're feeling. Don't talk about, guys don't get together with their friends and talk about their feelings. That's just a fact. But they should, and they can, and it's okay.
Linden is no stranger to suffering in silence after playing in the 1994 Stanley Cup Finals with a cracked rib. A new study showed that 68% of adults in Canada said their mental health has gotten worse since the beginning of the pandemic, with more than 72% of Canadian men having unhealthy habits that put them at risk for chronic conditions and diseases. Linden hosted a virtual event about the power of talking about mental health, but also the small changes families can make to improve their overall mental and physical well-being.
And I think we're continuing to break down those barriers and talk about, what's happening with us, especially now because it's been such a difficult situation. And mentally, it's been so hard. And I think it's brought a lot of that to the forefront, which has been good. And now it's just about, how do we deal with it? How do we handle it? And it's good for men to talk about how they're feeling.
What are you doing to manage your stress and kind of navigate it during the pandemic? Because we all know you as an elite athlete, you've been in high pressure situations, but this is obviously different than anything we've ever experienced.
I think we've all had our challenges with a situation that no one ever couldn't imagine the last 14, 15 months, regardless of what line of work you're in, the family stresses, the work pressure, just the change in lifestyle, the isolation we've all felt has been something that has been real. So, I think for myself, I always look at moving, whether it be going for a walk, going for a hike, a run, a bike ride, a workout, is not only is it good for me physically, but more importantly, I've always believed that it's the best mental health I can get, and it puts me in a better place.
If you go to menshealthfoundation.ca, there are a number of resources for anyone on tips to how to improve your mental health, to resources of people to talk to. For City News, I'm Lindsay Dunn.